Welcome to our video on understanding when and if your child might need speech therapy. First up, let's talk about the difference between speech and language. Speech is all about the sounds your child makes when they talk, while language is more about the words they use to express thoughts and ideas. Today we're focusing on speech, specifically, how well you and others can understand what your child is saying. If by 3 you're struggling to understand most of what they say, or by 4 other people are still having a hard time, it's a good idea to bring them to a speech therapist. For kids under 3 who are hard to understand, speech therapy can be tricky when it comes to them following directions. But here's the thing, if your little one is having a lot of trouble with sounds, there's usually a reason behind it. If we can figure out the reason and correct it before 3, they may not need speech or feeding therapy in the future. But don't worry, even if your child is over 3, finding the root cause of their difficulties can still save you years of therapy. Listen up, because what you're about to learn is crucial. We'll share all our knowledge because we want you parents to be as educated as possible so you can make the best decisions about your child's care. Okay, first, let's do a quick check. You should be relaxed right now. Where is your tongue? If it is up suction to the roof of your mouth, woohoo! You have correct tongue resting position. If it is down, you may want to see a speech therapist yourself. Incorrect tongue resting position is a very common reason for speech and feeding difficulties in young children. You see, your tongue is a natural palate expander. When it rests suction to the upper palate, it is nice and wide. Your tongue is also strong and toned and separated from your jaw. When it rests low in your mouth, your upper palate can become high and narrow. Your tongue becomes almost attached to your lower jaw, so talking and eating become difficult. Check your child's palate. If it looks like this, they might be at risk for future problems. But if it looks like this, there's a good chance everything is on track. There are many reasons for low tongue resting position. Oral habits such as thumb sucking, finger sucking, bottle use, and pacifier use. Did you know the American Academy of Pediatrics recommends stopping pacifier use by 6 months and weaning your child off bottles by 12 months, ideally before 15 months? But here's the good news. If your child is still young, eliminating those oral habits can make all the difference. The sooner they stop, the better. Other very common reasons for low resting tongue position are adenoid or tonsil enlargement, mouth breathing, allergies, or even tongue ties could be playing a role. It might be time to see an ENT or airway specialized dentist to get these issues corrected. If a child's tongue doesn't move separately from their jaw, it's tough for them to handle food in their mouth. This may look like picky eating, but it's not. They might avoid certain foods without knowing why, but their body is just trying to stick with what feels safe. This all can cause poor airway, which leads to poor sleep. Poor sleep leads to poor attention and behaviors. See how speech, feeding, airway, and sleep are all connected? If you have concerns, it is important to find a speech therapist who is trained in orofacial myofunctional therapy. We are excited to help prevent possible speech, feeding, sleep, and airway issues in your child. Thanks for watching.